Imagine that you were a child without the ability to communicate, without a way to tell others about your wants and your needs. How would you deal with the frustration that comes with your needs not being met or understood? Would you scream? Would you throw temper tantrums or throw other objects? How would you get the attention that you so rightfully need and desire? This is the reality that faces 1 out of every 12 children in the United States, according to a 2012 National Health Interview Survey. Hi, my name is Melody Tausch, and today we're going to be diving into one of the racial disparities that plagues the field of speech-language pathology. This is a topic that I've spent the better part of a year researching, covering peer-reviewed articles and studies, and staying up to date with the latest news statements from the largest organizations in the field that are working to remedy this issue. Statistical data shows that Black and Hispanic children are more often diagnosed with communication and swallowing disorders, but that they have less access to the necessary speech therapy treatments. And while steps have been taken in the right direction, there are still major barriers that face these populations to getting the therapy that they need. First, let's explore the evidence of this issue. Statistical evidence shows that there is a racial disparity within the field of speech-language pathology. There is evidence to show that more Black children are diagnosed than their white counterparts. The 2012 National Health Interview Survey showed that 9.6% of Black children were diagnosed with communication and swallowing disorders, compared to 7.8% of white and 6.9% of Hispanic children. There's also evidence to show that there is less access to speech services for Black and Hispanic children. The same 2012 National Health Interview Survey showed that 60.1% of white children received their needed speech therapy treatments, where only 47.3% of Hispanic children and only 45.8% of Black children received the same treatment. Published in an article by the American Journal of Speech-Language Pathology, there was a study done in 2022 that showed that Black preschoolers were given considerably less intervention time than their white counterparts. And even in the professional field, there are less Black and Hispanic speech-language pathologists. Zippia's career expert portal of 30 million profiles of 2019 showed that the ethnic breakdown of the professionals in the field were 82.6% white, 8.2% Hispanic and Latino, and only 4.2% Black. These are just some of the examples of the disparity that has been noticed by the largest organizations in the field of speech-language pathology. Action has been taken in the past at the college level and at the professional level to remedy this issue. Changes in the past were to reduce misdiagnoses of these populations. In 1983, African American English became an established dialect, changing it from a language disorder to just a language difference, similar to a New Yorkan or Southern dialect. Now, speech therapists can focus on and specialize in African American English and bi and multilingual focuses to better understand and help these populations. At the college level, there's been an increase in cultural competency and representation. The American Speech, Language, and Hearing Association is the accrediting body for all college programs dealing with this topic, and they have increased the cultural competency requirements of all speech-language pathology programs in the country. Even Columbia College hosts its own Speech-Language Pathology Day, where it recruits more diverse students and hosts speakers. And at the professional level, there has been efforts to increase diversity and representation. The American Speech, Language, and Hearing Association raises awareness for the profession and even has diversity recruitment materials for other institutions. And their own president in 2019 was Elise Davis McFarland, a Black woman who used her position to further the resources and access to these resources for these minority populations. And while progress has been made in the right direction, there are still major barriers that these populations face to receiving their needed treatment. The main thing is that doctors do not ask about minority children's development and that they adopt the wait-and-see approach. Andalusia Society of Speech Therapy released an article in 2020 that showed pediatricians ask minority parents less about their children's development than white parents. And in 2020, the Speech Space released an article stating the effects of the wait and see approach, showing that it ignored and bypassed the opportunity for these children to close the gap between them and their peers. Even in introductory speech-language pathology books, it shows that doctors are not properly educated on speech and language development, and that it's their duty as future professionals to work on an interdisciplinary team and close this gap of knowledge. And other common barriers. There was a presentation at the American Speech, Language, and Hearing annual convention in 2009 that covered a study that talked about the barriers minority parents faced. And the barriers most often reported by these minority parents were inadequate doctor advice, communication barriers between health professionals and the parents, inadequate knowledge of speech and language developmental milestones, and inadequate knowledge of speech services. Now that we've covered all of the evidence of this disparity, you have seen that Black and Hispanic children are more often diagnosed, have lesser access to treatment, and have lower quality treatment than their white counterparts. We've covered the steps taken to increase acceptance, diversity, representation, and inclusion at the past, at the college, and at the professional levels. And finally, you saw the barriers that are still in place today that these minority populations are facing. So I ask you again, imagine that you are an underprivileged child who cannot communicate to have your needs met or understood. That doctors ignore your needs and society hides the secrets to your right to communicate. How would you respond?